Hi, I'm Dr. Roadhouse, and I'd like to introduce you to our patient Audra, and she's in our thyroid program. So, why don't you just give us kind of an overall view of the symptoms that you had, and how long you've had them, and the things that you've tried, and the doctors you've been to.
Um, I have been trying to lose weight for multiple years, and I would do the fads and go to certain programs, and I would always gain. I would never lose. And my mom had a history of a thyroid problem, so I knew that there could be a thyroid problem with me as well. And I found online, thyroid symptoms, and I met most of those symptoms just reading them. And so I went to my primary care and said, I think I'm having a thyroid problem. He tested, it always come back normal. And this went on for about 3 years. And it was finally this year when I restricted myself to a very low calorie diet and I was gaining. I wasn't losing. That's when I knew that something was really wrong. So I searched out thyroid specialist and your name popped up. So
Okay, good. So we're just in the beginning stages of the program. Do we even have all your labs back?
yes.
Yeah, okay. We have all your labs back, and we're just starting in the program. So, I guess when you talk about all the thyroid symptoms that were bothering, like what are some of the, because you work and stuff like that. I mean, the sleep, fatigue. I mean, what were some of the ones that you really were having a difficult
I
time with?
always had dry, itchy skin. My insomnia was horrible. Like I would be dead tired and I'd be sleeping and or wide awake until 3 a.m. staring at the ceiling, and I just couldn't go to sleep. And then I'd be sluggish and tired in the morning, and I would have no energy and would never have enough energy to go exercise. So that, and then my hair was falling out in clumps.
Yet all your thyroid tests came back normal and that's why we do the 9 tests on the thyroid. And the thyroid, I mean, not only, does hair loss have to do with the thyroid, but also has to do with the blood sugar levels. We found stuff there. We found your A1C was high. The adrenals, your adrenals were not working right. And all of those, you can't have good hair development if you don't have it.
Right.
As a matter of fact, I've had patients come before who are really losing a lot of hair, and some doctors were injecting cortisone in the scalp. It wouldn't make the hair go back, but it'd kind of make it fuzzy and stuff like that. But see, they were on the kind of wrong track. I mean, they're on the right track, but doing it the wrong way. And we're trying to get the adrenals to start working right, along with the other things. Okay. Anything else? The symptoms, stomach-wise.
Yeah, certain foods would. Sometimes they'd bother me, and sometimes they wouldn't.
So that kind of left you confused. It's like, why do they bother me now? And
Right.
obviously, those were times when you're, more inflamed than others. Okay. What about like aches and pains and headaches and stuff?
I hardly ever had any headaches, but I always had joint pains in my elbows and my knees. Mainly my feet. I would have joint pain in there. But
and that's doesn't fall along a normal neurologic pathway. So when you go to doctors, they think, well, it hurts everywhere. Well, that's just full blown inflammation. That's what we're working on right now to get the inflammation down and help you that way. What about like any of the balance, the vertigo, the memory and stuff like that, the neurological?
I noticed this school year I was very forgetful. Things, I mean, I would write down and I would still forget to do them. Like there's a table in my classroom. It's been there for 7 years, and every day I would run smack into it with my left side. Like, where'd that table come from? Yeah. And I would get off balance real easily as well.
We noticed that when we did the initial neurological exam on you. So good. Well, that's kind of a synopsis of where she's at, not where she's come from, because it's been coming on over many years, but where she's at before she came in. So what we're going to do is we just started the program. We just got our labs back. We're getting her started on the program. So what we'll do is we'll check in with you in a couple months, 2-3 months, and then we'll see how your progress is. Because it's early yet to do that. So look forward to getting you all fixed up, and hopefully in 2-3 months we'll have a really good story to tell. Okay, thanks.